We've been to a number of events recently, some which have been run by other organisations. For example, InfoSec, which was buzzing. Clearly, security continues to be a very vibrant area and one which there's a lot of interest around. We also had our big health conference that's been running for about 30 years, HC, which was in Birmingham. We had about 2,000 people through the doors, and I think it's fair to say that those who are leading in health IT were very well represented. The Secretary of State unfortunately couldn't be there because he ended up going to Margaret Thatcher's funeral rather than us. We were understanding, I guess, and you can never plan for these kind of things. But it was very interesting to hear from a lot of the people who are leading change in the NHS. It's funny actually, just for a lot of our members, NHS IT is very interesting, even if they're nothing to do with it professionally. I think it's both a very interesting area, but it's also a very important area for social benefit, and it's also one where there's been a lot of interesting history about large projects. And the NHS itself is going through a huge amount of change at the moment, and it's always a bit of an afterthought that how the technology they use is going to support that change, and we're trying to make sure it isn't. One of the big interesting things there is about open data, and across government there is a big focus on citizen-centric design, so in this case patient-centric design, and a lot of things that you hear about issues in the NHS are to do with handovers between different agencies and different organisations, and so continuity of care is something that clearly needs to be supported by IT systems and by getting multiple diverse systems to work together. Generally the NHS is one of the last bastions of the piece of paper, and there's a huge opportunity for IT-enabled change there, but also a lot of unnecessary negative consequences if you don't do it right. And I'm not just talking about money wasted and projects being late. I'm talking about accidentally changing the way that we treat patients, accidentally changing the way clinical practice works in ways that aren't necessarily intended or beneficial. So as a body which has a lot of people who are very knowledgeable about the technology, both within and outside the health sector, and as a body that believes in what we're trying to do here, health is a very important area for us to show leadership. And HC is where we bring a lot of people together. BCS Health, which is our member groups in that area, do a lot of policy work in that area and are trying to make sure that as the NHS goes through these changes, that the IT is thought of up front and is at the highest level it possibly can be.